The parts of the pelvis. When it comes to the bones of the pelvis, it is composed of three parts called the ilium, the ischium, and the pubis. The ilium is the largest and most superior part of the pelvis. It forms a broad, wing-like bones on each side of the pelvis. It can be felt prominently on either side of our hips. The ischium is the posterior inferior part of the pelvis. It is commonly known as the sitting bone, and it is a bony prominence at the buttocks that supports our body when we are sitting. Next is the pubis. It is the anterior inferior part of the pelvis, and when the two pubic bones is joined together, it forms the pubic symphysis. The muscles within the region of the pelvis includes muscles such as hip extensors, hip abductors, and hip external rotators and internal rotators. The hip abductors include gluteal muscles such as gluteus medius and minimus. And for hip extensors, it includes the gluteus maximus. For the hip rotators, it includes the obturator externus, obturator internus, and the piriformis muscles. The parts of the hip. The hip is composed with bones and muscles that form the hip or thigh region of our body. The bone within the region of the hip is called the femur. It's also known as the thigh bone, and it is the longest, largest, and strongest bone in the human body. The muscles within the hip region or thigh region are the hip flexors, the knee extensors, the knee flexors, and the hip adductors. For the muscles for hip flexion, it involves the iliopsoas muscles and the rectus femoris. The rectus femoris also has a function in knee extension. Also, the sartorius is part of the hip flexors. It not only has a function for hip flexion, but also for hip abduction as well. The muscles for knee extension, we have the quadriceps femoris, which includes the muscles such as the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The quadriceps femoris, or the muscles for the knee extensions, can be found on the anterior side of the hip. The muscles for knee flexors can be found at the posterior side of the hip, and it includes muscles such as the biceps femoris, semitendinosus, and semimembranosus. The muscles that can be found on the medial side of the hip are called the hip adductors and includes muscles such as the adductor magnus, adductor longus, and the gracilis.
So the knee joint is the largest and most complex joint in the human body, connecting the thigh bone, which is the femur, to the shin bone, which is the tibia. It functions as a hinge joint, allowing flexion and extension while also providing limited rotation. Now moving on with the muscles that plays a vital role in the knee movement. The quadriceps muscles, located in the front of the thigh, are essential for knee extension. They include the vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. The hamstrings, located at the back of the thigh, help in knee flexion. They consist of the biceps femoris, semitendinosus, and semimembranosus muscles. The gastrocnemius and soleus muscles, or commonly known as the calf muscles, also have an indirect influence on the knee joint's movement. These muscles work in harmony to provide stability, strength, and control during various activities involving the knee. The knee joint involves three primary bones: the femur, which is the thigh bone, the tibia, which is the shin bone, and the patella, which is the kneecap. The femur forms the upper part of the knee joint, while the tibia makes up the lower part. The patella sits in front of the knee and acts as a protective shield for the joint. Articular cartilage covers the surfaces of these bones, reducing friction and enabling smooth movement within the joint. The ankle joint. Moving on, it is a hinge joint connecting to the lower leg to the foot, specifically the tibia, fibula, and the talus bone. This joint allows dorsiflexion, which is lifting the foot upwards, and plantar flexion, which is pointing the foot downwards. Muscles of the ankle. The calf muscles we discussed earlier, the gastrocnemius and soleus, also plays a vital significant role in ankle movement. The anterior tibialis, located at the front of the leg, allows for dorsiflexion. The peroneal muscles, including the peroneus longus and peroneus brevis, contribute to ankle stability and control during movement. The ankle joint consists of three main bones: the tibia, fibula, and talus. The tibia and fibula are the two long bones of the lower leg, with the talus sitting on top of them. Ligaments connect these bones, providing stability and preventing excessive movement. So in summary, the knee and ankle joints are remarkable structures that enable us to perform various activities like walking, running, and jumping. Understanding their anatomy and the muscles involved is crucial for maintaining their health and preventing injuries.
The functions of the pelvis. The pelvis also serves several important functions in the human body. For support and stability, the pelvis provides a strong, stable base for the vertebral column, and it connects the spine to the lower extremities. It also helps in weight bearing of the upper body during dynamic movement such as walking, standing, and sitting. The pelvis also protects the internal organs. It houses various important internal organs. In women, it protects the uterus and the ovaries. In both men and women, it protects the urinary bladder, the colon or large intestine, and the rectum. It also accommodates in the birth canal during childbirth. The pelvis is also an attachment site for numerous muscles and ligaments, which contributes to the posture, movement, and stability. Also, the ligaments of the pelvis also provide additional support for the stability of the pelvic joints. The functions of the hip. The hip portile region has many various important functions, such as weight bearing, stability, movement and mobility, transfer of forces, force generation, and posture of balance. When it comes to weight bearing, the hip joint, situated between the pelvis and the femur, is responsible for bearing the weight of the body during activities such as walking, standing, running, and jumping. When it comes to movement and mobility, the hip joint allows for many range of movements. Movements such as flexion, hip extension, hip abduction, hip adduction, hip internal rotation, and external rotation. When it comes to stability, the hip joint is designed to provide stability for the human body. The hip joint is a ball and socket joint which articulates with the acetabulum of the pelvis and is reinforced with strong ligaments, tendons, and muscles. The muscles that are involved in the stability of the human body with the hip joint is also responsible for the posture and balance of the human body. The muscles around the hip joint works together to keep the body standing upright and aligns the pelvis, the spine, and the lower extremities. It also helps in stabilizing the body and stabilizing the balance of the body during dynamic movements such as walking or playing sports. A function of the hip, also known as force generation, a group of muscles in the hip, particularly the hip extensors such as the gluteus maximus and hamstrings, generate force and power for activities such as running, jumping, kicking, and walking. These muscles coordinate with each other to produce a movement with efficiency.
The primary function of the knee joint is to enable flexion or bending and extension or the straightening of the lower leg. This allows for movements such as walking, running, jumping, and squatting. And the next function is weight bearing. It distributes the forces generated by body's weight and helps maintain stability by connecting the thigh bone or the femur to the shin bone, which is the tibia, and the smaller fibula bone. This function is the shock absorption. The knee joint, with the assistance of menisci, it helps distribute the force generated during the weight-bearing activities. And the next function is the alignment and posture, force transmission, and reducing the risk of injuries. The next part is the ankle joint. It provides a stable base of support for the body. The next function is mobility and movement. The ankle joint allows for a range of movements that are essential for locomotion, enables dorsiflexion. Imagine this is your foot, this is the dorsiflexion, and the plantar flexion, pointing the foot downward or away from the shin. These movements are necessary for activities such as walking, running, jumping, and climbing. The next function is balance and proprioception. The ankle joint, combined with sensory feedback from the foot, contributes to maintaining balance and stability. Proprioception, the body's sense of the position and movement of its part. It allows for fine adjustments in ankle position, ensuring stability, preventing ankle sprains or falls. It allows for inversion. Imagine this your foot again. Inversion. And eversion, turning the sole of the foot outward, just like this. Imagine this your foot, and this facing away. The next part is the foot, which performs several important functions in the human body. The foot function is to support body weight, enable locomotion and movement, absorb shock, maintain the balance, the stability, adapt to different surfaces, transfer energy, contribute to posture and alignment.
The body's pelvic, hip, knee, and ankle-foot regions are in charge of sustaining the weight of the body throughout varied everyday tasks and ensuring appropriate posture. Any discomfort or dysfunction in these regions can drastically impair physical capabilities, restrict mobility, and lower overall quality of life. And as a result, it's crucial to take care of these areas through exercise, appropriate footwear, and if necessarily, medical assistance.
Now that we have discussed the introduction to the lower extremities, such as the importance of it, the parts which are the pelvis, the hip, the knee, the ankle, and the foot, as well as the functions of these parts and structures, let's move on to the roles and responsibilities of physical therapists. Just what exactly do they do? Well, physical therapists are also known as masters of movements. But what's the reason for that? It is because they are very knowledgeable with the roles and responsibilities of a physical therapist with regards to the lower extremity is because due to it being very important for balance, weight bearing, movement such as walking. Damage to this can cause a lot of problems, and the patient's activities would lessen drastically. With that being said, walking, running, bending the knees to, sit down would no longer be such an easy task to do. Can you imagine that? Just how difficult it would be. So, it is the therapist's job to help them heal and go back to being able to do the activities that they couldn't do because of the damage in the lower extremities. Physical therapists would be the one who would help the patient regain their abilities to use the lower extremities through the use of exercises, maybe massages, help them learn how to use certain gadgets to aid them. Through that, they would be able to go back to walking, running, or doing sports.
Two examples of injuries in the lower extremity will be introduced and explained to further elaborate the role of physical therapists. One example is patellar tendonitis or jumper's knee. It is a common knee injury in athletes who overuse their knees and land heavily on them, which is typically done by volleyball, basketball, and long jump athletes. The patient experiences pain below the kneecap, and as a result, there is some weakness present in the knee joint. In severe cases, the patient may be required to undergo surgery. PTs come in post-surgery and make sure that the knee heals as quickly and completely as possible. They are provided with crutches or braces, and it is gradually removed as the patient is able to bear weight on their feet again through different gait exercises.
So another example would be osteoporosis, and it causes the bones to become weak and brittle if you fall or even a mild stress such as performing bending over and coughing can cause fracture, and this occur in your spine, wrist, and hip. So osteoporosis is a disease that cannot keep up with the bones, and this makes them weak and brittle. So in the early stages, you won't see any signs or symptoms. However, when the bones are already weak, the signs include sudden onset pain, typically on your thigh, the groin, the side of the hip, or the buttocks. So when you have osteoporosis, you'll have slightly limited motions, such as gentle hip motion is usually painless, but pain may intensify with extreme motion of the hip. There can be also a noticeable limp as you try to protect the joint and ease the pain. So as a physical therapist, our role is to help them support the hip by maintaining strength and flexibility of the area. There are also exercises that are recommended to lessen the pain. Water therapy is helpful because they ease movement and help relieve with the weight bearing, so you can walk more normally without the pain.
Knowing the foundations and understanding of gross anatomy and physiology will enable us to communicate effectively with patients and healthcare professionals to accurately document the progress of patients and make evidence based on clinical decisions. As future healthcare practitioners, it is essential that we have a proficient understanding of intricacies of human body to deliver the highest quality of care to our patients. Understanding the anatomy and physiology helps us to provide comprehensive patient care that addresses not only based on clinical decisions, but furthermore on different aspects. A thorough knowledge of anatomy and physiology is a critical development of treatment plans that are tailored to individual patients' needs. Therefore, to recognize the significance of this subject in our profession, growth, and committed to acquiring a comprehensive understanding of human body structure, functions, and systems. This knowledge will undoubtedly enhance our ability to provide high-quality healthcare to our patients, promote clinical excellence, and contribute to the advancement of our respective fields, which is physical therapy, and its practices po.
Our ability to explain gross anatomy to our patients can help them understand their disease, injuries, and treatment options. We can improve patients' comprehensions of their diseases, encourage adherence to treatment plans, and provide them the tools that they need to participate actively in their rehabilitation by describing anatomical structures and their functions. A thorough grasp of the structures of the human body, including its bones, muscles, nerves, organs, and blood vessels, is provided by gross anatomy. Having this knowledge aids in picturing and recognizing anatomical structures when evaluating and treatment patients.